Which energy system is primarily used during high-intensity, short-duration activities like sprinting? A. Oxidative. B. Glycolytic. C. Phosphagen. D. Aerobic. Answer: C. The phosphagen system is the primary energy system for short, explosive movements lasting less than 10 seconds, such as sprinting or powerlifting. What muscle is the primary mover in a squat exercise? A. Hamstrings. B. Gluteus maximus. C. Rectus abdominis. D. Erector spinae. Answer: B. The gluteus maximus is the prime mover during the squat, assisting in hip extension. Which plane of motion does a lateral lunge occur in? A. Sagittal. B. Transverse. C. Frontal. D. Rotational. Answer: C. A lateral lunge involves side-to-side movement, which occurs in the frontal plane. What type of contraction occurs when the muscle lengthens under tension? A. Isometric. B. Eccentric. C. Concentric. D. Static. Answer: B. An eccentric contraction happens when the muscle elongates while under tension, such as during the lowering phase of a bicep curl. What is the recommended rest period for maximal strength adaptations between sets? A. 0 to 30 seconds. B. 30 to 60 seconds. C. 1 to 2 minutes. D. 3 to 5 minutes. Answer: D. For maximal strength gains, long rest periods of 3 to 5 minutes allow for adequate recovery. Which of the following assessments is best to identify overactive hip flexors? A. Rockport walk test. B. Push-up test. C. Overhead squat assessment. D. 3-minute step test. Answer: C. The overhead squat assessment reveals compensations like an excessive forward lean, indicating overactive hip flexors. What structure connects muscle to bone? A. Ligament. B. Fascia. C. Cartilage. D. Tendon. Answer: D. Tendons connect muscles to bones and allow for movement by transmitting force. What is the primary role of the sarcomere? A. Store glycogen. B. Send electrical impulses. C. Contract muscle fibers. D. Supply oxygen. Answer: C. The sarcomere is the functional unit of a muscle fiber responsible for contraction. Which variable would you manipulate to progress an endurance training program? A. Rest. B. Speed. C. Load. D. Volume. Answer: D. Increasing training volume, more reps/sets, progresses endurance adaptations. Which zone of the heart's rate reserve corresponds with high-intensity interval training? A. Zone 1. B. Zone 2. C. Zone 3. D. Zone 4. Answer: C. Zone 3 represents vigorous intensity effort used in HIIT. Which muscle is overactive if the knees move inward during an overhead squat? A. Gluteus medius. B. Vastus medialis oblique. C. Adductor complex. D. Piriformis. Answer: C. Overactive adductors can cause the knees to move inward during squats. What is the primary goal of Phase 1, stabilization endurance training? A. Maximize strength. B. Improve anaerobic capacity. C. Increase proprioceptive demand. D. Build maximal muscle mass. Answer: C. Stabilization phase emphasizes balance and neuromuscular efficiency. What joint action occurs at the hip during the upward phase of a squat? A. Flexion. B. Extension. C. Abduction. D. Adduction. Answer: B. The hip extends as you rise from the bottom of a squat. Which training strategy uses a sequence of exercises with minimal rest? A. Linear periodization. B. Superset. C. Circuit training. D. Pyramid set. Answer: C. Circuit training involves performing multiple exercises back-to-back with little rest. What is the ideal tempo for the stabilization phase of the OPT model? A. 4/2/1. B. 2/0/2. C. 1/1/1. D. 1/0/1. Answer: A. The 4/2/1 tempo increases stabilization by slowing down movement. Which method improves power most effectively? A. Slow tempo with heavy loads. B. Long rest periods. C. Supersets with contrast loads. D. Continuous aerobic training. Answer: C. Power is developed using supersets that contrast heavy and explosive loads. What type of flexibility involves holding a stretch for 30 seconds? A. Dynamic. B. Active isolated. C. Static. D. Ballistic. Answer: C. Static stretching involves holding a stretch for a prolonged period to improve muscle length. What macronutrient is the primary source of energy during moderate intensity exercise? A. Fat. B. Protein. C. Carbohydrates. D. Fiber. Answer: C. Carbohydrates are the main energy source during moderate exercise. Which organ stores glycogen for energy use? A. Pancreas. B. Kidney. C. Liver. D. Gallbladder. Answer: C. The liver stores glycogen and helps regulate blood sugar levels. What describes an open-ended question in client interviewing? A. Do you like running? B. How many reps did you do? C. How do you feel about your progress so far? D. Are you tired today? Answer: C. Open-ended questions encourage discussion, vital in building rapport with clients.